medical panel. We've got Dr. Ann Kabeka, Dr. Ann Childers, Ali Miller, Dr. John Lemansky, and Dr. Nadir Ali. So what I would like to do is form a very nice, polite, respectful line at the microphone. No elbowing like last year. I'm looking at you, Kevin. And you can ask questions, but what I would prefer not to have happen is, hey, tell me how I can fix my medical problem. Not those kinds of questions. So we're not here to fix you as an individual right now. I love you. They're ambivalent, okay? So if you have specific questions, please come up. Make sure you speak close to the microphone so that everyone in the audience can hear you. All right, so please, by all means, first one up.
Not all at once. So far, so good. Yeah.
Come on, moderator. There you go.
Start singing.
I will dance. Go ahead.
I've got a loud voice, so okay. I have two questions actually. Opinions on long-term health effects of being on ketogenic diet? Anybody?
Allie, will you go first?
Sure. Hi. So I like how I was like, this one. It's good moderating, Brian. So as far as research, to my knowledge, I don't know much that's out there documenting long-term effects, but the types of labs that you can monitor, you can always look for. A lot of the negative things that we hear are incorrect understanding of what the ketogenic diet is. So when you're working with your healthcare practitioner, it's absolutely important that you distinguish ketoacidosis first off from a nutritional ketogenic diet. And then the next thing that we hear and that's the concern of pH in the bloodstream and danger to the kidneys. The other concern that we hear is protein, long-term high protein effects on the kidneys. And that's also if electrolytes are off and we're dehydrated. I don't have any concern for biochemical and physiological understanding of mechanisms of the body for long-term use of a ketogenic diet with nutritional levels. But I will say if you're looking for confidence and understanding to share with and work with your healthcare practitioner, that there are labs that you can run to continue to show that your dietary approach is optimal and managing your body and has no harmful effects. So some of the things that you can consider looking at would be managing your inflammation in the body, like your C-reactive protein and your SED rate. Other things you can look at managing are your insulin levels. Fasting insulin is a very important marker to watch that we often see go down with the ketogenic diet. And if you see unfavorable shifts in lipids for a short term, it's really important that you look at a lipoprotein particle test. And you also look at things like homocysteine, which is a marker of vascular inflammation, which also tends to go down as you reduce the inflammatory foods with a ketogenic diet. Things like a comp, which is going to look at your blood urea nitrogen. It's going to look at your ALT, your liver enzymes and stuff. Good to monitor every 90 days or so. And I don't know. Those are the types of things that I would monitor.
I would agree to all of that, absolutely. And then I would just add inexpensive urinary pH testing to periodically to make sure you're getting enough minerals, you're getting a urinary pH of 6.5, 7, 7.5 on a regular basis, because we know long-term lower urinary pH is associated with osteoporosis. And working with women, we definitely want to monitor that and make sure that we have that, paying attention to that, getting enough minerals and nutrients in the diet. And all those markers, I always look at the vitamin D 25-hydroxy, hemoglobin A1C, DHEAS, and HSCRP as 4 core markers that everyone here should know their numbers on for sure, and just kind of following that. But I see I see good long-term benefits with it.
Okay. Dr. Ali, do you have anything to add for long-term ketogenic?
I would say that those were pretty good information, but you can also take some information from isolated populations like the Inupiats, like the Maasai of Africa. They live their entire life in a ketogenic state, or at least having a ketogenic type of diet. So I would say, I don't want to repeat the markers, but I would do that, and some follow-up is necessary.
Okay.
Anything to add?
From a psychiatric standpoint, I've had really just one patient who went deep keto, and she seemed to be doing really well. So I can give you an anecdote. But she did not do well emotionally, and she kept being stressed and depressed. And so what I realized is that I should do an inventory of what she's eating. What I found out is that her protein source was plant-based. And at that point, I suggested, because it was partially meat, and she was open to eating meat, I said, well, let's go ahead and make it animal-based, and she recovered. So.
Oh, excellent. Excellent.
And
Okay.
the only thing else I would add, can I speak? Okay. You didn't ask me, so. Okay.
I'm asking you.
All right. Well, no, I think the only other thing I would mention is, so to differentiate between being in strict ketosis all the time versus being more in a low carb, high fat. So certain people, I think, who are metabolically quite ill benefit tremendously from being strict ketosis for longer periods of time. But if you are metabolically healthy, your goal is not, significant weight loss, being more in a low carb, high fat state, I think is sufficient for most people. Unless you're trying to reach therapeutic levels for certain purposes. Let's say you have traumatic brain injury, epilepsy, things like that, cancer per se. At that point, you would benefit from being more in a ketogenic state.
Okay. Thank you. My other question is more specific to somebody that has an artificial heart valve and being on a ketogenic diet. Any thoughts on that? Safety, risk profile?
What type of heart valve?
Artificial.
But like mechanical?
Mechanical.
So they're on Coumadin or?
Yes.
Animal-based food is very low in vitamin K. If you're on Coumadin, you cannot eat leafy greens and other types of vegetables that would provide you with a lot of vitamin K. So you're actually more in tune with your artificial valve being on a low carb. And I like the idea about not always calling it as a ketogenic diet, because even people who go low carb, they're deriving majority of their calories, or their cells are getting energy not from ketones, but from triglycerides. Mm-hmm. So you don't necessarily have to be in, I see Dave Feldman nodding, these are things that I learned from being a part of this community. So yes, being on a low carb program is in keeping with having a mechanical artificial valve, and you would have a little bit more flexibility if it is an aortic type position rather than if it's in a mitral type position, because of the way the blood flow characteristics are. So I hope that answers your question.
The reason why I was asking is this person's fear of doing this is because the cholesterol. The doctor is saying you have to be on Lipitor because she's got higher cholesterol, and she doesn't want to do the ketogenic diet because she's afraid it's going to compromise her health. Okay.
You can grab any of these folks afterwards.
Okay.
Can I just give one comment on that? I would change the doctor. Because the artificial valve has nothing to do with cholesterol.
Okay, thank you.
Hi, my question is on autoimmune disorders like SLE and RA and like maybe Hashimoto's. Would you say that there's demonstrable benefits from a ketogenic diet? This would be arguing the case with physicians.
Yes, absolutely. So, if you think about the underlying mechanism for most of those autoimmune diseases, you have a genetic predisposition to one. And for whatever reason, whether it's leaky gut, there is a trigger that activates it in individuals. So if you take rheumatoid arthritis, for instance, a lot of studies have shown that ketogenic diet or low carb, high fat reduces inflammation. And so inflammation can be measured as far as high-res CRP or ESR. By decreasing that, just anecdotally, people will say joints feel better, markers of inflammation go down. So you can extrapolate that to other autoimmune diseases, which have been shown, and specifically, I think Dr. Childers can talk about, multiple sclerosis being another one that has been shown to be quite beneficial from being ketogenic.
Excuse me, since you mentioned leaky gut, is that a symptom or is that a primary? Is it an erosion of the? We're hearing a lot more about it. What is leaky gut syndrome?
I would love to talk about leaky gut. And to add to Dr. Lemansky, gliadin, which is the protein primarily in gluten and wheat-based foods, has been demonstrated with both Hashimoto's and rheumatoid arthritis to specifically interfere and drive the forms of inflammation with those pathologies in particular. So just by going grain-free and gluten-free is the first step in, and then you're going to get the therapeutics beyond with the high-octane fuel of ketones. So leaky gut is a condition where the lining of the GI tract, so we call it in the medical field intestinal enteropathy when it's severe or can be actually assessed with a colonoscopy. We use a marker called secretory IgA, which is a marker of our mucosal membrane, and you can test this in the stool. You can also test it in the saliva, and it speaks to the integrity of the gut lining. Gut lining integrity can get degraded by actually stress. Emotional stress can start to create what I call Swiss cheese in your gut lining. So you can start to drill holes in the gut from stress. NSAID use, so drugs like Aleve, Advil, that a lot of people that are dealing with chronic pain and autoimmune disease take on high dose, even if it's pharmaceutical grade, ibuprofen or what have you. NSAIDs destruct the gut lining. And then there's genetic components like inflammatory bowel disease and Crohn's, ulcerative colitis. But often autoimmune disease does correlate because we know 80+% of the immune system resides in the gut. And when we have reduced gut lining function, we get enhanced immunological compounds in the bloodstream. And that's where we get inflammatory cascades. So a lot of disease does come back to healing the gut, and that can help to drive remission of autoimmune disease. And so I would state that yes, leaky gut probably preceded the autoimmune condition and was a driving cause.
Thank you very much.
I just want to add to that because the low-carb community is a little bit naive to this. And that is the importance of understanding human digestion, and that stomach acid is a very key component of reducing bacterial overgrowth in your stomach, in your intestinal lining. So that's a condition called SIBO, small intestinal bacterial overgrowth, that happens when you have low stomach acid. And as we get older, the stomach acid goes down. And another thing that we are doing to reduce the stomach acid is the widespread use of PPIs, proton pump inhibitors, H2 blockers, antacids. So stomach acid and measurement of it and evaluation of that is crucial in somebody who has immunologic disorders, who you are thinking about as leaky gut.
I'll just add that most autoimmune diseases are in women, and so we have to think of hormone disruptors in our environment. And as we've got this great convention center with grass-fed products and organic and gluten-free, non-GMO, that is so important because those contributors to leaky gut, intestinal enteropathy, et cetera, are just profound and unarguable. So I think that's really important, is removing those disruptors in those individuals, as well as recognizing autoimmune disease has multiple factors. Ketogenic diet's definitely part, elimination diet's part, but also the emotional and psychological healing that has to occur as well for complete healing. So.
Thank you very much.
Hi, I know that much has been said about Alzheimer's, but what about Alzheimer's that you're predispositioned to get? How does that diet play into effect with that?
Unfortunately, I'm not well versed on that, so I'm going to have to pass the question. Yeah. You're talking about ApoE4?
If you can do keto with ApoE4?
I know you can, but is there a benefit?
I was just going to comment on, you can, so with, I do a virtual food as medicine keto program, and when we're taking into account genetics, you can absolutely still do a high-fat diet, but in my protocol, we do adjust the amount of saturated fat with an ApoE4 because of the genetic way that they metabolize those types of fats. So you can still have your macronutrients to be 70% or greater of fat. I just emphasize, I think that the jury's still out, but I emphasize a higher intake of monounsaturated fats in that population and a little bit more plant-based. I don't restrict, like to be fair, I don't restrict, I'm just mindful of the amounts of the saturated fats that they're consuming. But it's still by no means within the recommendations of American Heart Association or a low-fat diet by any means.
Where can I find more information on anything that is out there?
Oh, and can I make a quick comment real quick too? Beyond ApoE4, if we're talking about Alzheimer's and dementia, so we know the benefits of like MCT, right, and C8 specifically. There's other nutrients like glutathione, which is an antioxidant that's made by the liver. So when we're talking about detoxification or reducing toxins, we need to look at this holistically, and I think often we get very tunnel vision specific on certain biomarkers. We need to be mindful of what the body needs, and I look at a micronutrient test. I use a white blood cell proliferation type panel, and what I like to see is specific deficiencies. So choline, another nutrient made by the liver. Acetylcholine plays a role in neurotransmitter conduction and signaling. Some people are choline deficient, and that drives Alzheimer's and memory dysfunction. There's some people with the glutathione, which would also have arthritic conditions following with that. There's some people that aren't eating enough fat. So, I think there's a micronutrient element beyond macros in keto to take into account to optimize brain function and reduce cognitive decline.
Thank you.
Sorry.
I would also hook up with Amy Berger. She's here at the conference because she would give you a lot of resources.
Thank you.
She's in the back.
She has a book called The Alzheimer's Anecdote. Yes, I'm not a doctor, and I'm answering. Alzheimer's Anecdote. Alzheimer's Antidote. Thank you. I'm not a doctor. It is fantastic. It's very good. And she's also here. So just go out there and scream Amy Berger. There she is. Okay.
There she is.
Yeah, she's waving her arms. Yes. Next question, please.
Hello, I recently been experimenting with carnivore keto. My last experiment, like 50 days, where I've ate nothing but from the animal kingdom, no carbs of any sort, including veggies. Do you see anything on the medical side of any concern for extending carnivore keto for any length of time?
Sure. Can I answer this as a non-medical professional? I will answer this as a non-medical professional. I don't know when the last time I ate a vegetable was. I'm 44. I don't like vegetables. I don't eat vegetables, ever. I have not died. I'm perfectly good.
Lots of resources for you. Sean Baker is there on Twitter. You should communicate with him. He answers all the time. Amber Ohan, she's been doing it for a long time. I have been inspired by them, and I have been carnivore keto for a long time. I don't have any issues. I feel good. So I have not seen any specific biomarker change for the worse in patients that I have recommended carnivore keto.
I think unfortunately, if you're going to look for medical research into the carnivore keto to kind of justify that as a way of eating, you're never going to have that. So I think to kind of talk, same as Dr. Ali, looking at the biomarkers, I'm assuming that you're looking at different biomarkers in terms of inflammation, insulin, fasting glucose. If all those markers are improving, then chances are it's going to be something that's beneficial for you. But I don't know if we as a medical community will ever have the answer for you as regards to whether or not that's healthy or not, unfortunately.
I will. I'm not in the medical.
The medical university of Brian says it's good.
I look at this from a traditional diets perspective, and some of the people that are eating carnivore, and I believe people are carnivores, don't get me wrong, and I've said that before, I'll say it again. But I think that if you look at the diet of the Inuit versus our modern day access, I kind of wonder about it, especially in women of reproductive age. I always have concerns about that. I wonder if we need to eat enough offal, and that's why I mentioned offal. in my presentation. So the liver is like is the multiple vitamin of the animal. So I think in a modern foodways situation, we're kind of reinventing the wheel. So we have yet to see what will happen, and maybe you can eat, what is that, ribeye steaks 3 times a day and be just fine. It looks like we have people here who are, but I couldn't swear by it yet. Yeah.
I just want to add a couple of points on that. One is the concept of nose to tail eating, because we eat mostly predominantly muscle mass in this country, whereas liver, kidneys, brain, they carry a lot of nutrients. The gelatin from your feet, there is a delicacy in South America in which they cook the feet of cows and goats. That's extremely good. I would look up Denise Minger. She is not necessarily keto, probably more paleo, but she has a beautiful amount of information about the dangers of eating just muscle as opposed to adding all these nose-to-tail eating practices.
Anyone else? Thank you. Next question.
Yeah, some of you guys' thoughts about, say, an individual who's seeing a physician who's being followed on the ketogenic diet, any particular population or certain patients that are absolutes as far as should not be on a ketogenic diet? And they're having improved physical symptoms. Like, say, somebody, I mean, your guys' thoughts on pregnant patients, breastfeeding, chronic kidney disease, severe heart disease. I mean, you guys' thoughts on those?
Yeah, I mean, I think, so you mentioned a few off the bat. So anybody with eating disorder, pregnant, breastfeeding, I wouldn't recommend a strict ketogenic diet. I still think that you can do very well with a low-carb, high-fat diet still. My wife had 3 children on a low-carb, high-fat diet, and she survived, so that's good. Anything else?
Chronic kidney disease, your thoughts?
Yeah, I mean, I think the studies in terms of chronic kidney disease as it relates to protein intake, stage 3, stage 4 kidney disease really is not shown to be detrimental to people consuming higher protein content. So I don't think that being a low-carb, high-fat or ketogenic on that type of basis would be detrimental.
So no absolutes, just a preference as far as if somebody is sort of breastfeeding.
Well, I think
or pregnant.
pregnancy and breastfeeding, I would not be strict ketogenic with no carb intake. Yeah.
And I think also, again, emphasizing the toxins we're getting from our food sources in pregnancy and breastfeeding. We definitely want to make sure we're getting nutritional phase 1, phase 2 detoxification support during those times and actually throughout our life, right? Because we're exposed, we're not living in the Amazon, we're exposed to incredible amounts of environmental toxins from what we breathe, wear, use on our skin, et cetera, as what's in our food and food sources, plastics, BPAs, we know all those disrupt. So take into consideration what we're putting in and making sure we're using the nutrients we need to get those out. So in pregnancy and breastfeeding, it's so important prior to pregnancy and breastfeeding to manipulate those toxins out, but at any stage of our life as well. So adding those minerals, adding those detoxification support ingredients would be powerful.
And I think with, like you said, as long as they're getting good outcomes, I breastfed while doing keto. It's about watching your milk supply, watching watching where your child's at and not over restricting. You don't want to be number obsessed with doing blood ketone measurements and trying to over restrict your body when you're trying to produce nourishment for another being or grow another being. But if organically you're eating berries only and that's your desire, I also don't see that as concerning to be in light nutritional ketosis while breastfeeding and your milk production is good. I think that that's absolutely appropriate.
Thanks.
Next question, please.
Hi. I'm a family nurse practitioner. I work in a conventional medical system, a fairly large hospital system in my state, and I often am a firm advocate of the ketogenic diet for a lot of my patients, particularly those with diabetes. But part of me in the back of my mind is thinking what happened with Professor Noakes and having my license taken away or having major ramifications because I'm going against guidelines. Do you have any advice for me about this?
I'm in private practice, and I think about this a lot, too. because they have this community standard of care, and if you don't live up to the community standard of care, then you are considered to be in a problem zone. And in fact, I was told a few years ago that I would be a strange duck by an associate professor at our local university if I continued my practice this way. Strange duck meaning quack, basically. That's what he meant. So, so we do think about this a lot. The good news about Professor Noakes is that he's just won twice now. And he compiled, yes, applause for Professor Noakes. Did a marvelous job. He actually kept his medical license so he could go through all this. He did. This is amazing. He sacrificed a great deal. He was called back a second time. Apparently, the HPCSA, his medical board, was not happy with the outcome, and he won again. We just found this out last week, so this is amazing. So, or maybe it was this week. Anyway, it was not very long ago. So he wrote this book called The Lore of Nutrition, and he basically takes you through every step of what happened, and he updates you on all of the information and evidence that helped him win these two trials, so to speak. They were hearings. So I would encourage you to get a copy. They've had a hard time getting it distributed in hard copy. But I found it on Kindle at Amazon, and that should be widely available to anyone who wants it. I'd recommend it.
Yeah, I would say every physician who's promoting a low-carb, high-fat, or advanced nurse practitioner is very concerned about this. I do think that with Professor Noakes, being vindicated, that gives more credibility to what we're saying. You do have doctors like Dr. Westman who have shown a lot of research. What I would tell you is I would start documenting every single person that you treat and have kind of a case file that you can use and say, look, if for some reason you get questioned as to what it is that you're doing, you can show not only the benefit that people are getting from this, but then you actually have the research behind it. The other thing, I think, long-term, what's going to happen with what Nina Teicholz is doing to try to change the guidelines. So you and I are bound by these guidelines that are set at the government level. Until those change, it's going to be very difficult for really the establishment and the way things are run to change. And that goes not just for community, hospitals, but schooling system. Everything is kind of driven by that. So I think there is change on the horizon. I think the community here, the people that come out to these conventions that are growing, work by Brian and other people who are putting on conventions to get this message out. And then social media, which is, obviously has its negative sides, but I think the more that this information gets out, the more stories we hear about people who are benefiting, and the more that we see labs that are improving, it's hard to ignore. So I think it's happening. You're in the middle of it.
I would say that a couple of things that drive me to do it is that I want to be relevant. At the end of the day, I want to feel like I have made a difference in somebody's life. And we are in an era in 2018 which is very different than what these guys were, like Professor Atkins and even Dr. Westman or Jimmy Moore, for example, about 10, 15 years ago. We have a lot more research, we have a lot more science, we have a lot more personal stories backing us up. So I think that in this current day and age, if you get into legal trouble, there are a lot more resources to help you out.
Anything else?
Only thing I would say is if that ever were to happen, make sure you contact all of us. Yeah.
Thank you very much.
So I've heard a lot already about like people losing weight on keto and everything, and like the whole obesity and research. But I haven't heard anything about being underweight and using keto to purposefully gain weight. Is there any research on that? Just anything?
Yeah, there'll be a talk
What's the title of your?
on cancer. Yeah, so I mean, the only research, the major research that's out there, and I don't want to give too much away, but it's really on cancer and maintaining lean body mass while you're on chemotherapy. So I would come to the talk tomorrow about that.
Okay.
I had celiac disease. I was down at 102 pounds, and I'm now, I guess, 22 pounds more now. So you can imagine I look like a skeleton.
Right.
And yeah, so I started out with Weston A. Price, but eventually went into keto, and I can tell you that I finally, as I started eating whole foods and restoring fat to my diet and getting adequate protein, I started picking up weight. And now when I step on the scales, I can step on the scales three months from now and probably be within a pound or two of my weight today. It just remains the same. It seems that it would help me reach my set point. So there's an anecdote for you.
And it didn't like curb your hunger and everything, because that's always like the side effect of keto.
It curbs my hunger, but I love food, and I'm actually much more excited about food now than I was when I was eating the standard American diet, or SAD, right?
Right.
So yeah, it's funny because I got sent by the VA to the eating disorders clinic, and my medical director said, anybody who thinks you have an eating disorder has never seen you put down a steak. It seems like my body now knows what it needs, and it probably helped me to clear up my leaky gut that I had from the celiac disease. So I think it is a healing approach.
And I was just going to add, in the pediatric population that I work with, the only ones that I've experienced that have had, at that point we don't call it failure to thrive, but growth delay or developmental delay, are on a very high carbohydrate diet and aren't getting ample protein or healthy fats, and often with too low of stomach acid and inadequate digestive enzymes. So eating is a very taxing situation for the child, and then they fill up on foods like simple carbs, breads, crackers, and those types of things. And so I do see that the ketogenic diet or a higher fat, lower carbohydrate diet can definitely enhance growth, development, and maintain a healthy, stable weight. What I haven't seen it do is drive weight beyond a healthy point. And so I don't know if that answers your question. If that's a goal, I haven't seen that, but I'm sure you could challenge the body to do that with anything.
Okay. Thank you.
I had a question about cardiovascular disease, right? Is cardiovascular disease reversible? If not, can you maintain, by following a low-carb, high-fat diet, can you maintain your score, or does it still go at a rate of 15 to 20% every year?
So I would say that at this point, the studies are not out there yet that would look at outcomes research. That's number one. Number two is imaging research. When I say imaging research, that means that you are doing coronary calcium scoring or IMT serially over several years to find that out. But you can be comforted, at least partially, that there are several surrogate markers of progression of heart disease that do get better. I think that insulin resistance by far drives heart disease a lot more. And really, when you're looking, physicians should learn to look at lipid profile as a surrogate marker of insulin resistance. Not look at LDL, but look at triglycerides and HDL, and figure out from that, along with few other biomarkers, as to whether this person is insulin resistant or no, and how they are trafficking their energy. So I would say if you look at every single parameter, whether it's inflammation scores, whether it's coagulation markers, whether it's homocysteine, all of these biomarkers do get better. Do I have outcomes research or imaging research to help you? No, I don't have that at this point. But I think the other option is not any good either, because if you start eating the standard American way, then you're going to have all these other biomarkers go bad, and that's what we've been doing for 50 years, and we've been doing pretty badly at it. So that kind of summarizes what I would say.
There's a great book by Dr. Stephen Masley, who wrote on the heart, and he also studied coronary arterial how do you say, IMT. Thank you. So he studied that, looked at measurements with ultrasound and also all the coronary markers, and that's published in his book. It's by Dr. Stephen Masley, and it's on the heart. So if you search for him, there's a lot of good research on that, quoted a lot of studies that looked at, high-fat, low-carbohydrate diet in this population.
I do have one more question, right? I've not been able to find evidence on the vitamin K2, MK7, right? Because what I'm not able to figure out the answer is K2 takes calcium out of your arteries, right, and puts it into the right places, but then calcium is just a way for body to prevent the cholesterol from getting into the arteries, so calcium has never been a problem. It's the cholesterol that's actually getting into the arteries that's the problem. So if I start consuming a high dosage of vitamin K2, which takes the calcium out, right, then I'm just exposing the damaged arteries, right? Isn't that going to be bad? Or because I couldn't find evidence if it's good or being bad. So any opinions on that?
This is an amazing question. What you're asking really is that if a coronary artery is already calcified, is removing calcium from it bad?
Yeah.
And I'm not sure anybody knows the answer to that, but in terms of as to how K2 is helping either in animal models or in humans, I would look up the work of Dr. Leon Sugars. He is out of Europe. He's done a lot of rat model studies. There is human studies, that's the Rotterdam trial. So basically, in brief, what MK7 or K2 does is that it increases the activity of the MGP protein. The MGP protein is carboxylated, and carboxylation of that shifts the calcium from the blood vessels to the bones. And you want to keep it there. You want to keep the calcium in the bones and not have it in your arteries. So having adequate levels of vitamin K2 is absolutely essential for vitamin D to work. So I would say yes. I don't have an answer to your question. It's a fascinating question. And it's something that we should look into.
Thank you.
Hi, thank you for doing this. Given the discussion that you all just had about how difficult it is to advocate for the ketogenic diet as a doctor, that kind of ties in with the experience that we've had in trying to find a doctor that could talk to us knowledgeably about being on the ketogenic diet instead of instantly saying my cholesterol's too high, go on a statin. So we're looking for a doctor that will advocate for the ketogenic diet in the Austin area, and we're wondering how in the world do we find one?
I'm surprised.
I think that, one of the resources I always send patients to is functionalmedicine.org, and search for a physician that's had functional medicine training. And that was I was just at IFM this year, and we talked a lot about the ketogenic diet. So there's a lot of education still that needs to happen, but there's a good advocacy there. So I would start, I would definitely look, and I can name a few docs in Austin that would be awesome. So.
If anyone knows any keto-friendly doctors in the Austin area, tell me, because I will let everyone in the world know who they are. And you won't, so.
I give you.
So.
Ann Shippey, MD, Amy Myers, MD, are two that come to the top of my head that are in Austin. Okay. Having breakfast with them tomorrow.
Okay, good.
Thank you very much.
Okay, this is the last question. Last question.
Hi. I was curious if you guys have any thoughts on blue zone research, particularly regions that don't necessarily have ketogenic diets like Costa Rica.
This is a kind of conscientious point right now. So if you look at all the blue zone areas, right, they have one thing in common. So they eat different types of diets. They have different environments. The one thing that they have in common is community. And so it's hard to extrapolate from different areas saying that it's their dietary practices. I would venture to say that they have a purpose, they have a community, and that's really what drives their longevity. The second thing is that they got lucky. They have very, very good genetic makeup. So most of those blue zone areas, they get the same diseases that Western people get. They just get them very late in life. So it's not a question of they don't get diabetes, they don't get cardiovascular disease, they don't get strokes. It just happens much later on in life. And I think a big component of that is genetics.
I do want to emphasize that too. Community builds the hormone oxytocin, love, connection, bonding. I always argue with my resveratrol colleagues, definitely a great antioxidant. But is it drinking the red wine that gives us that longevity factor, or is it the table of friends and the community we're with and we're laughing and enjoying each other that actually stimulates oxytocin, which helps to heal the cell membranes at the cellular level that improve our longevity and health? So I would agree, just to emphasize community like Brian's created here. So it's awesome.
Yep. Cool, thanks.
It occurred to me as I was sitting here being the stupidest person on stage, I've interviewed all of you on my podcast. I was like, yes. Oh, and I'm still the dumbest guy on stage. Thank you. That's what I was thinking about. John, Dr. Lemansky, that's what you were thinking about? Well, I was thinking about coloring, but other than that. Thank you very much, everyone, for coming out, for answering the questions. If you're here for the rest of the weekend, if you see any of these ladies and gentlemen, please pull him aside, especially Dr. Lansky. Especially if you see him engaged in something, just interrupt him. He loves that. So, but please ask the questions. This is what we're here for. And yes, to answer to address the community thing, from the day one that I started everything, it's about community. So if you have not hugged someone here today, I have failed. And don't let me fail. Don't leave here without hugging someone today. Okay? Okay? All right. We are done for the day. Thank you very much, ladies and gentlemen. We're done for the day. Pack your stuff. Get ready for another awesome event day tomorrow. Thank you so much, everyone.